Hi, today I'm going to explain what can happen when the first step of swallowing, which is also known as the oral preparatory phase, what happens when the structures are not working properly during this phase. I'll use an example of a patient named Maria. I got this example from ChatGPT. So Maria is a 68-year-old woman recovering from a mild stroke. She loves to eat yogurt since she can't eat other foods that require more chewing, since food will typically fall out of her mouth. She has to chew very slowly since she can't move the substance efficiently, and sometimes small bits of her food will slip down her throat too early before she's ready to swallow. So now I'm going to explain what structures are involved in this process. First is our lips, which includes the muscle orbicularis oris. And the function of this is to seal the lips and keep the food inside of our mouth, which is controlled by cranial nerve 7, also known as the facial nerve. Next is the cheeks, which includes the muscle, the buccinator, and this just helps hold the food against our teeth within our mouth. And this is also controlled by cranial nerve 7, which again is the facial nerve. The next structure involved is our jaw and teeth. So this is going to be the masseter, the temporalis, and then the medial and lateral. Sometimes I can't say this word, peterygoid, which is controlled by cranial nerve 5, the trigeminal nerve. More specifically, it's controlled by the third branch of the trigeminal nerve, which is the mandibular branch. And again, since it's our teeth and jaw, it's just mainly used for chewing and biting the food. The next muscle the next structure that we use is going to be our tongue. And this includes the intrinsic and extrinsic muscles, which is just basically to move around the food and to form that bolus that we're getting ready to swallow. And this includes the hypoglossal cranial nerve, which is cranial nerve 12. And then the last structure that we use during this phase is the soft palate, which includes the levator belli palatini, which is just basically keeping the back of our mouth relaxed so that we can also breathe while we're chewing. And this is cranial nerve 10, also known as the vagus nerve. So when we look at the functional consequences of this includes, the spillage, which is when the food is going to fall out of the mouth and might be messy, which could cause Maria frustration. Next is the poor chewing, which can cause longer meal times, thus making Maria tired. And then lastly is, again, that spillage that goes down the throat too soon or too early, which can increase her risk of choking and aspiration. So overall, the functional consequences of this is just honestly the decreased safety and that Maria has to rely on somebody else during these feeding times, which can cause a lot of frustration for her. So basically, in conclusion, this is the oral preparatory phase. Your mouth is just prepping the food, getting ready to swallow it, which uses your lips, cheeks, teeth, jaw, and tongue. And all of these muscles are working together, even though we don't even realize it. So when one of these muscles is off or one of these nerves don't work, it can make it harder and less safe for chewing and getting ready to swallow. Thank you.